Good evening, ladies and gentlemen. My name is Rhonda Copeland, and I represent the Georgia Society of Community Gardeners. I came today to speak to you about a very important public health issue in our communities across the state. In the state of Georgia, there are 875 identified food deserts. Food deserts are defined as areas where there is limited access to fresh fruits and vegetables due to limited retail outlets or due to there not being outlets within close proximity to where people live. Food swamps are areas where only fast food and high-calorie foods that are laced with salts and sugars are located in a community. Studies have concluded that the results of living in a food desert are disproportionate rates of obesity in adults and children, uncontrolled hypertension leading to kidney failure and dialysis dependency, dialysis centers flooding low-income neighborhoods. Studies conducted in Los Angeles and Chicago found death rates due to diabetes to be twice that of neighborhoods with better access to supermarkets. These food deserts are breeding grounds for diseases such as diabetes, hypertension, and heart disease and obesity. In communities where food deserts exist, income is low. Low income is associated with poor access to health care, which compounds the risk to this population. This in turn influences the cost of medical care to this population because chronic health conditions develop early in these populations and are often irreversible, leading to death and high health care costs. My purpose here today is to present a proposal which would help to eliminate and reduce the impact of food deserts in our Georgia communities. Increasing access to and consumption of fresh fruits and vegetables is an important public health goal. The Society of Community Gardeners asked me to represent them here today to present some compelling facts about community gardening and its benefits to the community and individuals' health goals. The benefits of community gardening include access to healthy, affordable vegetables in low-income neighborhoods, cost savings to families who participate in gardening and supplement their groceries by eating from their garden, increased intake of fresh vegetables. Community gardening is associated with a healthy diet that is lower in calories and higher in fiber. As of 2013, the Supplemental Nutritional Assistance Program, known as SNAP, benefits can be used to purchase seeds and plants so that low-income households can grow their own food. Centers for the Study of the Presidency and Congress, 2013, reported these benefits. Community and home gardening is associated with a lower body mass index. High body mass index are associated with diabetes and heart disease. Other benefits of home gardening and community gardening include potentially effective interventions to improve nutrition and food security in low-income groups. This makes it important to document the extent to which gardeners, less affluent ones, increase vegetable intake when eating from their gardens. The top benefits reported in a survey of home gardeners was exercise, meeting with friends and learning from other gardeners. Reduction in fast food consumption was another benefit. the program that the Society for Community Gardening is proposing to the legislation today is for allocations of funding to encourage and support community and home gardening. We're asking for a $1 million grant to purchase a $1 million annual grant to purchase land, equipment, and equipment for harvesting and tilling. A $2 million annual grant to purchase seeds and fertilizer for communities and home gardening, and to support workshops and cooking classes on vegetable preparation and canning. Also to support community gardeners in public schools by creating green spaces. Support studies to analyze changes in healthy habits of our community. The total annual cost of the funds that we are seeking is $5 million. Thank you.